What are the risks and side effects of treatment medication, and how do I establish fact from fiction?
Everything has a risk, and almost every medication has a side effect. In fact, the side effects of some medication are what we use to treat people with. It's very difficult for me to detail all those right now, but you as a patient should be informed about what the medication will be expected to do positively, and also about the side effects to look for. But I think it's important in the discussion with the doctor to ask about that. I mean, what can I look for, doctor? Are there special risks? Because this transaction between you and the doctor is about trading off one risk against another. The risk of using illegal drugs in the street versus the risks of taking a long-term medication.
Some of the big problems with being on pharmacotherapy are the interactions with other drugs, especially other sedative drugs. And it doesn't matter whether they're prescribed or not prescribed, but things like Valium, sleeping tablets, of the benzo class. Alcohol is very important, interacting, again increasing the likelihood of overdose or sedation, and combinations of those drugs, which can all increase the potential problems there.
In terms of other sorts of side effects of opiates, there's quite a few. The most common one by far would be constipation. Almost anybody on methadone and many people on buprenorphine would get constipation. Other common ones would be sweating. A lot of people get sweating on the medications. You can get some nausea early in the piece. Usually it goes away, usually it's self-limiting. Some people can get swelling of the joints, particularly swelling of the ankles. That's not that common, but it does happen to a few people. Occasionally people get headaches when they start them, particularly with buprenorphine actually. Particularly with buprenorphine, people can get a headache early in the piece, and most of the time that goes away with simple analgesics like paracetamol or aspirin.
Now, very rarely do these ever mean that people need to leave treatment. Sometimes they may need to switch from one mode of treatment to another, but usually your clinic can help you deal with some of those.